So if I could turn now to our second speaker, Dr. Margaret Grigg, who will be talking from a departmental perspective. And Margaret is an experienced health professional with extensive experience in senior leadership roles. She was previously Deputy Chief Executive of Mind Australia and Vice President of the Kyneton District Health Service Board. She has worked with the Victorian Department of Health and Human Services as a senior executive for many years and is currently the Executive Director of Health Service Policy and Commissioning. Please welcome Dr. Grigg.
Thank you, Ernie and Professor Irving. Can I also begin by acknowledging the Wurundjeri people who are the traditional custodians of the land on which we meet, paying my respects to their elders, past and present, and to any other Aboriginal people who may be with us today. I really like the kind of message about this as a community issue, and probably want to begin by acknowledging the breadth of people that we have here today. Not just the kind of usual suspects from our public health services, particularly emergency departments, flow coordinators, but also our private hospital partners, Ambulance Victoria. I saw some uniforms down the back there. People from aged care, our peak organisations, primary health networks, community health, and also Department of Justice, as well as some DHHS people. So, you know, what's really, really important, and what I think is, I'm hoping, the strength of some of today's conversation, is the opportunity for us to have a much more kind of joined up discussion. And really the opportunity for us, I'm not very good at using those overheads. I don't know how much they really matter to the conversation. Oh, it's that way. There you are. That's a picture of Victoria. There you are. So, flu happens every year. I did walk along here and think, look at that beautiful sunshine, and we're worrying about flu. It happens every year, but kind of too often, even though we know it happens, it comes and it causes us surprise. We all know what happens in hospitals. More people come into emergency departments. We see more older people. We see people landing up in hospital for longer periods of time. We see elective surgery cancelled. We see staff going off sick. We see stress within our system. And then often reflected in a range of other ways. Our ambulances take longer time. And this pattern happens every single year. And it's kind of interesting, sometimes the lack of presentation for something that's not an unpredictable event. It's both a very predictable event, an event that we actually know an awful lot about, both what we can do to help avoid it, but more importantly, how to manage it when it occurs. And so one of the really important parts of today is really to get that conversation going, getting fantastic innovation, such that Professor Irving's just pointed to a couple of really simple, straightforward things we can be thinking about now, that we need to start putting on the table. There's no doubt that the severity of last year's flu season has become a little bit of a lightning rod for us to reinvigorate and rethink about the way in which we at the department go about supporting and preparing and advising government on some of the things that we can do. I'll go to the next one. I am trying very hard, viewer. We've all seen plenty of slides. One of the things that happened in the middle of the flu epidemic, as we saw it, was that the Minister for Health called a flu roundtable. Not very surprisingly, she was really, really concerned at both the increase in prevalence, the problems we were seeing within our healthcare systems, and her concerns for the health of Victorians. And so she called a flu roundtable, where a group of really clever people, some of those people are in this room today, sat down and talked about what were some of the things that we could do. I think one of the learnings from that was it was too late to do most of the ideas that we came up with. So most of the things we said, well, we could do this and we could do this, it was clearly too late. And so one of the opportunities of today is to really saying, what are the things we need to do now? What's the planning? How can we begin acting? That similarly, from the perspective of the department, what did we need to learn? And what were some of the things that we needed to do earlier and in a much more coordinated way across the system? I kind of have to reflect, occasionally in your life you have real people like children, but I do have family members who work out in hospital land in real jobs dealing with the problem. And her reflection to me on all the comments made on purchasing private capacity was good on DHHS. You know, we looked to purchase private capacity in the private system when most of it was all over. And I think it was a really important point to us that it's really important for us to step up to the plate of this early preparation. So this is actually about us partnering together. This is about us better understanding from you what it is that you need us to do, at what time, in what timeline, knowing when we're in the face of a flu epidemic. Actually, we've all got tensions and pressures that make many of our actions too late and ineffective. So a couple of the things that certainly we've heard loud and clearly the importance of communication to the Victorian community about both the notion of immunisation, something that is causing us some concern with all of the press of the ineffectiveness of last year's vaccination, really trying to counter that with the continued importance of vaccinating our community, but also a range of key messages about both respiratory hygiene, kind of how to cough, staying at home when you're sick, thinking about how else you might kind of access to reduce the extent to which you spread that virus through the community. We think they're really, really important messages, and you'll hear a little bit more about that campaign. The Minister has announced that we will be vaccinating children between 6 months and 5 years. Again, lots and lots of evidence about the way in which they pull virus to make us all sick. Any mum and dad knows that. And also very much looking at our targeted vaccination rates for healthcare workers. I do feel a really great sense of pride in Victoria that we don't have to mandate. We don't have to tell people what good and professional practice is. It's actually a principle our Minister holds strongly, because there's certainly been very active conversations of should we pick up the question of mandated. The truth is we have very high vaccination rates, and we think in a whole range of ways engaging and respecting the professional nature of these are random overheads, of our workforce will be really, really important. It is also important for us to look at a whole range of ways in which we look at immunisation of other vulnerable population groups. And think about the way, so the department, for example, does a whole range of work with vulnerable populations, and one of our active conversations is how do we increase our vaccination rates amongst those clients we're delivering disability services to? How do we think about those? And certainly I do want to echo the calling out and thinking really specifically around the issues for pregnant women. We will be also looking to really think about the way in which we have antivirals much more accessible. And the mechanisms of accessibility. It was fantastic to hear the example of the pharmacy across the road, the way we can use really effectively community assets. Certainly we have a network of supercare pharmacies where again become a platform for us to engage more broadly into the community. Think about some potential trials and work through our community health centres. But for all of you, understanding actually there's a range of assets outside of your wall, and you can often very easily draw on them, is some of the early planning that we hope to do. We have asked you all to, all the public health services, to write winter plans, to do some thinking and bring those, send those plans back into us. Some of the innovation that we see through those plans will be discussed today. But I'm also really conscious that at the end of the year, what will be important is for us to learn from those. There's a lot we know that is effective, and we should make sure that we all put it in place, but actually there's still a lot of innovation for us to learn. And there's still a lot of really different ways, and I'm in the lucky opportunity of visiting many health services, and often you go over here and you see a fantastic thing happening, and then you go over there and you go, oh gee, that would have really helped you. And again, I don't think that we do enough. One of our roles should be really fostering and providing opportunities for you to share innovation. The workforce planning issues are really important. Of course, we know staff will get sick. We can plan for that. There's really interesting conversations that happened about how we think about the changeover of our staff, how they rotate wards, how we think about planning for exams, how people themselves plan for their winter holiday periods, how I don't know, as we talk to one health service, you don't routinely perhaps have one respiratory clinic once a week, 48 weeks of the year. Maybe actually what you do is through periods of the year have 2 or 3 clinics, and maybe in other parts of the year you only need that clinic once a fortnight. Let's rethink some of our patterns of service delivery so that they're much more responsive to what people need. I do want to give some acknowledgement to Better Care Victoria. They were here meeting before. We are so pleased from the department to have the partnering with Better Care Victoria, more broadly Safer Care Victoria. I think it's given us a depth of understanding of safety and quality, a depth of capacity to engage and move beyond perhaps some of the more administrative controls that we've overly focused on, and perhaps helping us get much more to the core of practice and learning and spreading. So their work will be really important. Can I thank everybody again for being here today? Particularly, I'm going to wave to you people. I hope there's somebody at the other end of that camera, but there's a special wave to you because it takes extra concentration. The other people in the room have to. I just really appreciate your time. We are really interested in your very honest feedback from today, both in terms of the value, but in terms of what is next steps. What I want to say to you very deeply from the department is we are here to partner with you. We are here as part of the system. Sometimes partnering and our various roles mean we need to have honest, sometimes uncomfortable conversations. Can I say we're really up for it? We're very up to hearing very directly from you, to being challenged in the context of you telling us the role we need to play. Similarly, we hope you're up to, from us, hearing from our perspective, the roles and perspectives we think you're able to do. Again, I think it's one of the things we should all celebrate, the maturity of a system that really kind of sometimes lets us talk about the real issues, however uncomfortable they might be, and not just kind of sit in the sort of rhetoric of nothingness. Thank you, have fun.